Let's look at this issue of mental health a little closer because evidence suggests that compassion can improve depression, anxiety, shame, and self-criticism. It's been shown to reduce rumination and improve body image, and it sometimes helps with psychotic disorder. The research also suggests that compassion enhances well-being, happiness, and allows a greater sense of meaning. It expands connection to others through healthier, more satisfying relationships and improves overall emotional intelligence. Compassion can also be very powerful in the way it promotes healing from pain and suffering. So just briefly, what if your client has a negative attachment history or a history of trauma? We'll be dedicating a whole entire week to this in Module 4. But just briefly.
The really amazing thing is that the research is showing even people with difficult trauma histories or, psychosis or very difficult to treat conditions, they can learn self-compassion. It's not like just what you're born with. It's not just your genes. It's not just your early childhood upbringing. In some ways, what self-compassion is learning to reparent yourself, actually learning to give yourself what you may not have gotten as a child.
That's an important thing to remember about compassion. It can be powerful, even when there are challenging issues in your client's past. Case in point, a small randomized study was done at Emory University that examined compassion training on participants who had a high severity of depressive symptoms and had recently attempted suicide. They were also African American. The Emory research team wanted to see how compassion training might impact depression and self-criticism. So to do this, they randomly assigned participants to either a 6-week compassion training or a 6-week support group. Participants in the compassion group were encouraged to meditate daily and complete practice assignments after each session. The study found that participants in the compassion training group showed greater reduction in self-criticism and depression. Fascinating, right? This suggests compassion interventions can be a powerful tool for ameliorating self-criticism and ultimately in decreasing depressive symptoms.